His name was Martin. Martin was 66 years old, a retired firefighter. Physically active his whole career, never smoked, rarely drank. By any standard measure, he was a healthy man. But for 3 years, he had been waking up exhausted. Not tired, exhausted. The kind of fatigue that sleep did not fix. His joints ached in a way that felt different from his old injuries. He had put on weight around his middle, despite eating the same way he always had. His thinking felt slower. His doctor ran the standard blood panel every year. Cholesterol, fine. Blood pressure, fine. Blood sugar, fine. Everything looked fine. Except Martin was not fine, and he knew it. It was only when his cardiologist ordered one additional test, a test that is not on the standard blood panel, a test that most men over 60 have never had, that the picture changed completely. That test showed a number that explained everything. The fatigue, the weight, the joint pain, the cognitive slowness. 3 years of feeling like his body was working against him. That number was his hs-CRP, his high-sensitivity C-reactive protein, a direct measure of systemic inflammation. And it was elevated. Not because Martin was sick in the traditional sense, but because of a process called inflammaging, a process that is happening right now in the bodies of most men over 60. A process that standard blood tests do not show, that most doctors do not have time to explain, and that most men have never heard of. By the end of this video, you will understand exactly what inflammaging is, why Martin's story almost certainly has elements you recognize in your own life, and, most importantly, what the research says you can do about it. Stay with me, because halfway through this video, I am going to tell you about the one daily habit that research now directly links to accelerating this process. And it is not what most men expect. Let me start with what inflammaging actually is. You already understand acute inflammation, even if you have never used that word. It is what happens when you cut your finger. The area goes red, swells, feels warm. Your immune system sends resources to the injury site, kills bacteria, starts the repair process. It is protective, it is necessary, and when the job is done, it switches off. Inflammaging is the opposite of that. Inflammaging is a state of chronic, low-grade inflammation that develops with age. Not in response to any specific threat, but as a persistent background condition. The immune system stays in a state of mild, continuous activation. It never fully switches off. And this slow-burning fire, invisible, painless, producing no obvious symptoms of its own, quietly damages tissues, organs, and biological systems throughout the body. The term was coined in the year 2000 by Italian gerontologist Claudio Franceschi. In the 2 decades since, it has become one of the most researched concepts in the science of aging. Studies published in Nature, Geroscience, and Frontiers in Aging confirm it as a significant driver of age-related disease and functional decline. In plain terms, inflammaging is not a side effect of aging. For many men, it is aging. Now, I need to show you exactly what this silent fire is burning. The research on inflammaging and the cardiovascular system is unambiguous. Elevated levels of inflammatory markers, particularly interleukin-6 and high-sensitivity CRP, are strongly associated with heart disease and stroke in older adults. A large study of over 17,000 patients found that those with hs-CRP levels above 2 milligrams per liter had a 42% higher risk of all-cause mortality compared to those with lower levels. 42%. From a number that is not on a standard blood panel. The research on inflammaging and the brain is equally clear. A major longitudinal study following over 5,000 adults found that elevated IL-6 levels in midlife predicted poorer cognitive performance and greater decline over a 10-year follow-up, equivalent to nearly 4 additional years of brain aging. And here's the part that surprised me when I first studied this deeply: the connection to muscle. Research from Örebro University and the University of Nottingham showed that CRP, one of the core markers of inflammaging, does not simply correlate with muscle loss. It actively interferes with protein synthesis inside muscle cells, causing them to reduce in size. This is a causal mechanism, not just an association. A fourfold increase in hs-CRP has been measured in older men compared to younger counterparts, and this directly predicts decline in both muscle strength and physical performance. Think about what that means for Martin, and for you. The fatigue that won't resolve, the muscle that is quietly disappearing, the cognitive fog, the weight that accumulates despite no change in diet. These are not separate problems with separate causes. They are the same fire, burning in different rooms. And the extraordinary thing, the reason I wanted to make this video, is that this fire can be measured, and it can be reduced. Before we talk about what helps, I need to show you what is making it worse. Because here is the habit I promised you. The one most men over 60 have. The one that feels harmless. The one the research now directly links to accelerating inflammaging. It is poor sleep. Not occasional bad nights. Consistently sleeping fewer than 6 hours. Or having deeply disrupted sleep. Spending less time in the slow-wave restorative stages that aging naturally erodes. Research published in peer-reviewed immunology and sleep journals has demonstrated that sleep deprivation directly elevates circulating levels of IL-6 and CRP. A single night of significantly disrupted sleep produces measurable increases in inflammatory markers by morning. Chronic sleep disruption, which is extremely common in men over 60 due to prostate symptoms, sleep apnea, pain, and the structural changes in sleep architecture that come with age, creates a sustained pro-inflammatory state that feeds directly and continuously into inflammaging. A 2024 review in Frontiers in Immunology described adequate, consistent sleep as one of the most powerful modulators of immune aging in older adults. And yet, this is almost never discussed in the context of inflammation management. Men are prescribed statins to lower cardiovascular risk. They are almost never told that fixing their sleep could lower their inflammatory markers, without a prescription, without a side effect, and without a copay. Think about Martin. 3 years of waking up exhausted, despite 8 hours in bed. His sleep architecture had deteriorated. He was spending far less time in deep sleep than he realized. His immune system was quietly firing all night, every night. Sleep was not the only driver, but it was the one nobody had looked at. The other major drivers of inflammaging in men over 60 are interconnected. Central obesity, the belly fat that accumulates after 60, is not passive weight. Visceral fat is an active endocrine organ that produces pro-inflammatory cytokines continuously. Every kilogram of excess visceral fat adds to the inflammatory burden. Reducing it measurably lowers CRP and IL-6. Physical inactivity. A peer-reviewed study comparing older men with low versus elevated systemic inflammation found a clear pattern. Men with lower hs-CRP were significantly more physically active, spent more time in moderate to vigorous activity, and consumed higher amounts of antioxidant vitamins. Movement is not just good for the heart. It is one of the most consistent anti-inflammatory interventions available. Chronic stress. Concerned. Persistent elevation of cortisol promotes pro-inflammatory signaling over time. Loneliness, which research shows increases dramatically in men after retirement, has been independently linked to elevated inflammatory markers. Social isolation is not just emotionally painful. It is measurably, biologically inflammatory. And as we covered across the last 2 videos, gut dysbiosis and long-term medication effects on the microbiome directly increase intestinal permeability, allowing bacterial products into the bloodstream that trigger and sustain systemic immune activation. The gut is not separate from inflammaging, it is one of its primary engines. Now, what the research says actually works. Let me give you a simple frame for this section. Think of inflammaging like a smoke alarm that never turns off. Not because there is a fire, but because the battery is faulty and the sensor has become too sensitive. Everything I am about to share with you works by either removing the things that are triggering the alarm or by recalibrating the sensor itself. The first intervention is dietary pattern. Multiple peer-reviewed trials confirm that a Mediterranean-style dietary pattern, high in vegetables, legumes, whole grains, oily fish, olive oil, and nuts, is associated with measurably lower CRP and IL-6 in older adults. A 2024 clinical trial published in Microbiome Research Reports found that a polyphenol-rich diet, consistent with Mediterranean principles, produced significant decreases in both IL-6 and CRP in participants aged 60 and over, alongside improvements in gut microbiome diversity. The mechanism is multiple and reinforcing. Omega-3 fatty acids and polyphenols directly modulate inflammatory pathways at the cellular level. They feed the beneficial gut bacteria that produce anti-inflammatory compounds. They are associated with reduced visceral fat over time. You do not need a perfect dietary overhaul. The research is consistent that gradual, sustained shifts toward this pattern produce real anti-inflammatory effects. Encouraging, adding oily fish twice a week, increasing the variety and volume of vegetables, replacing refined grain staples with whole grain alternatives. Each shift recalibrates the sensor slightly lower. The second intervention is the one with the most striking evidence specifically in men: resistance exercise combined with adequate protein. A randomized controlled trial in older adults examined 8 weeks of resistance exercise plus a high-protein omega-3 enriched diet. In men specifically, this combination significantly reduced circulating IL-6, the IL-6 to IL-10 ratio, a key marker of inflammatory balance, and HMGB1, a second inflammatory marker. Muscle power improved significantly. The anti-inflammatory effect of this combination was more pronounced in men than women. For men over 60, adequate protein is not just about building muscle. It is a direct intervention in the biological process that is driving your inflammation. Research suggests 1.2 to 1.6 grams of protein per kilogram of body weight per day, distributed across meals, as a target for older men. This is higher than traditional dietary guidelines, which were designed for younger populations. The third intervention is sleep. And I want to come back to this specifically because of Martin. After his elevated hs-CRP was identified, Martin's care team looked carefully at his sleep. He was assessed for sleep apnea, which turned out to be present but previously undiagnosed. He was also found to be waking 3 to 4 times per night due to prostate symptoms, a problem that had been managed but not optimized. Addressing both of those, through CPAP therapy for the apnea and a revised approach to his prostate management, did not require new medications. It required paying attention to something that had been accepted as inevitable. 6 months later, his hs-CRP had fallen from the elevated range into the low-risk range. His fatigue improved substantially. His joint pain was reduced. He told me it was the first time in 3 years he felt like himself again. His cholesterol had not changed. His blood pressure had not changed. The standard panel looked the same. But the silent fire had been reduced, because someone finally looked for it. Let me bring everything together. Inflammaging is a chronic, low-grade inflammatory state that develops with age and drives the most serious health challenges men face after 60. Cardiovascular disease, cognitive decline, muscle loss, metabolic dysfunction, and fatigue. It is not a disease in itself, it is a process. And it is a process that the standard blood panel was never designed to detect. The things that accelerate it: poor sleep, physical inactivity, central obesity, gut dysbiosis, chronic stress, the cumulative effects of long-term medication on the microbiome, are largely within your influence. The things that reduce it: a Mediterranean pattern diet, resistance exercise with adequate protein, consistent high-quality sleep, and active engagement with your own healthcare, have strong, specific, peer-reviewed evidence in older men. And the single most important thing you can do today is this: ask your doctor to check your hs-CRP, your high-sensitivity C-reactive protein. It is not on the standard panel, but it can be ordered. It is inexpensive, and it will give you a number, a single number, that tells you whether Inflammaging is actively working against you right now. Bring this video to your appointment if you need to. Show your doctor this. Ask the question. Because the research is clear. High hs-CRP in older adults is associated with a 42% higher risk of mortality. and most men have no idea their number is elevated because nobody has ever checked it. Martin did not need a new medication. He needed one test and 2 changes. That was it. If this series has been useful to you, if these 3 videos have genuinely shifted how you think about what is happening in your body after 60, please share this with one man in your life who needs to hear it. And subscribe, because we are not done yet. Because here is what I need you to understand before the next video. Everything we have talked about in this series, the medications, the gut, the inflammation, has a single converging point: your muscle. Not just your strength, your survival. Research now shows that muscle mass in men over 60 is one of the strongest independent predictors of longevity, cognitive preservation, cardiovascular resilience, and recovery from illness. Stronger than weight, stronger than cholesterol, stronger than almost any single biomarker your doctor currently measures. And most men are losing it, every single year, without knowing it is happening, without being told what is driving it, without understanding that the medications they take, the gut bacteria they feed, and the silent inflammation running in the background are all accelerating the loss. The condition is called sarcopenia, and in the next video we are going to talk about it directly, what it is, how to know if it is already happening to you, and what the research, the specific rigorous research on men over 60, says you can do to stop it and reverse it. Because the fire we talked about today, this is what it burns most. I will see you there.